So in the process of how I do this for ThaiVedic students is we move through a case study. We see how they have gone through applying the principles of ThaiVedic to their client, and then I grade and mentor them on that process. We have a look at what conditions are being treated for that client, and we track what doshas are imbalanced for that client. And this client is a much more complex client and one of my own personal clients that I've moved through. The main condition it has come to me for is pain, experiencing pain and not able to walk. Because as I diagnosed it through, there was a psoas shortening syndrome, and that was preventing him from being able to stand erect. As I went further in, I realized there were issues with fluid and blood related to gout, uric acid buildup, and this acid overloading the pelvis that then made it very susceptible for this psoas shortening to get worse and the pain to get worse, sort of a trigger of the pain of why they came into the deeper reasons of what's happening inside the terrain of the body for this client. And the reason I chose this client as well is because within a lot of the case studies, we've been getting a lot more deficiency orientated clients with more straight out vata conditions, compared to this client that has a constitution that may be more pitta kapha, has all doshas aggravated with armor, and a much more excess associated case in some way, rather than a deficiency associated case that we've been commonly seeing through the students and treating. This person is likely in more excess. Now, as we're doing it live, you can have any questions you want at any time as we go through. I'll just keep presenting, and at any time, feel free to ask a question. What I'll do now is I'll move towards a Word document where I've gone through sort of putting information from my case history into a format that is similar to what the students go through. I've used the same style questions from a yoga therapy level 1 grading form. These are the conditions we're working on. And when we ask the client in the beginning, what are their chief concerns or imbalances? What things is most important for them to work on? So pain is the first thing. Can't walk erect without pain. The daily pain intensity is around a 9 out of 10, so it's a lot. We track these symptoms, these chief concerns and imbalances, through a process of origin, duration, and what makes it better and worse to find the dosha behind the symptom. So the origin of this pain has had many pain conditions in the knees and lower back, but the first time this happened was 10 days before we met, and still can't walk without lots of pain and posture contortion. So I'm going to give some visuals in the video of posture contortion that was taking place, particularly because he had been doing cycling on a bicycle in the days before the accident, and this was likely the trigger for the pain and the spasm. There was some form of muscle spasm causing the pain. Through examining his movement patterns and what made the pain worse, it was obvious that the muscle origin was the psoas muscle. So the psoas muscle, I'll give another visual online here, is a deep inner muscle running from the inside of the lower leg all the way up through the pelvis and attaching on the lower back in here. And it's involved in this movement where we lift the leg up towards the chest like this. So when we're on a bicycle, and we're going along on a bicycle, that psoas muscle is being repetitively activated during that bicycle movement that's there. And it's also in its shortest state when we sit down on a chair as well, which is a common trigger for this shortening psoas, is a short, long periods with the psoas in short compared to the iliopsoas, this whole long muscle. And as we'll learn, a big fascia channel as well needs to be in some way long with the leg further back behind us to be able to get length through the iliopsoas muscle that's there. So we saw a clear trigger with the riding of a bicycle that's shortening it. I could see in his own posture the way in which it contorted the posture was much more in the direction of pulling this and this together at the pelvis so that it stays in that shortened position. And if we lengthen, it gets pulls on the lower back and creates more pain and tension there. So they're unable to stand erect. They're often more one side than the other. With this client, it was more particularly the right side where it was shortening, and therefore there's a slight contortion forward and to the side, a little pulling as they're walking and trying to cover in and contort in. And that's the posture pulling from the iliopsoas that takes place, particularly when the muscle is in spasm. I'm going to share my screen and continue through the rest of the symptoms there. The duration within days with strong, obvious trigger related to exercise. So whenever this happens, then the treatment needs to be more specific to get a more immediate result. We'll talk about the relationship from general treatment to specific treatment. We've got an acute imbalance that's within the last day. So specific treatment is more needed here to get results quickly. Nothing too intense. There wasn't like the bicycle riding was lots of hills or he went for a long amount or something, just did a few rail trail cycles. So there must be an internal environment allowing this riding of the bicycle to be so triggering. There was some body internal environment that had already prepared for this little trigger of the bicycle to go, oh, too many repetitive movements for the iliopsoas. I can't get circulation in and out effectively enough of that muscle. I need to lock up into spasm for safety now because of the lack of circulation that's moving through the muscle at the time of activity, even though a small amount. So it highlights a lack of proper circulation. What makes it worse? Trying to stand erect. So we see that when the muscle is going into its elongated state, it's not able to elongate. Walking is very tiring because we're in this contorted posture and we're using a muscle that's slightly in spasm. Whenever we do that, it's a lot of energy for the nervous system, very taxing for the body. Riding a bicycle made it worse, as we saw already. And any strong exercise in the past has made many of his imbalances worse. What makes it better? He said nothing. But if I checked qualities and started to ask through questions throughout the rest of the consultation, it was better after a shower or a bath, so showing better for warmth in some way, and after rest, so better for stillness there. Then when asking about sleep, he mentioned that all his pain symptoms get worse if he does not get a good sleep. So again, key clues here. A lot of these, what makes it better, are highly related to balancing vata there. And then also this, walking is very tiring, worse for exercise, highly related to, again, vata as the causative factor around this trigger and this pain symptom. Repetitive inflammatory conditions after exercise, so weeks for the pain and inflammation to go away. This is his next major symptom. This started quite a while ago. Started in his 40s, yeah, that was 25 years ago. He's in his 60s, this man. So first in the shoulder and then in the legs, and particularly the knees. As I palpate tissues and get locations, it is mostly around ligaments, tendons, and soft tissue structures around the joints. There is redness on the skin, a little bit through the face and in some parts of the body. This duration of 25 years, it's been going on, yeah. For quite a while, this repetitive inflammations. What makes it worse is exercise. And he was somewhat of an athlete before this period, and then not able to, in this constant inflammatory blood state, where the muscles were not able to recover from exercise because the blood was in a poor position and therefore not able to tolerate even a bit of exercise stress and repair after that exercise. What makes it better? Rest and intermittent fasting. So the moment we see intermittent fasting makes it better. In some ways, this could indicate some like metabolism, half digested byproduct issue. Repetitive inflammatory conditions often show, oh, it's some metabolic immune system and metabolism are so related. So some immune and metabolism issue that's going on. And if intermittent fasting makes it better, maybe there's a food that's not digesting as well, and that's leading towards toxic blood or challenges with the blood and repetitive inflammatory conditions throughout the body. So the blood being a prerequisite towards the muscle imbalance that's there. And I'll talk a bit about that and how we treat that directly. The next symptom he talked about was the gallbladder removed after a gall attack in 2005. Now, by this stage, I'd already decided we're going to do a bodywork session for the first thing, and I diverted because really he's there for the pain. So these other things, I just gathered information during that first bodywork session where, because he was in so much pain and we had to be very adjusting with the bodywork, accommodating to what his body could do, I allowed lots of dialogue and conversation. And as I touched across his body, I asked various questions and etc. The gallbladder. So years, yeah, it's been gone since 2005. What makes it worse? He didn't really know until the pain was just intense and boom, I'm having a gall attack. So that straight away shows me that he's not as aware of the subtle quality symptoms of imbalance that may have been taking place, and he may require some education on how to know of what are those subtle ways that the body's becoming imbalanced before it throws out strong, intense symptoms. What makes it better? Clean, organic food and not overeating. From around this time, he started to really clean up his diet quite well and ate a lot more clean, organic food. Yet he still overate occasionally and had quite an abundant life. Gout attacks in the past and now using herbal formulas to decrease occurrences. So he didn't really talk about this in the beginning because he hadn't had any gout attacks for a while. He'd been using some formulas to decrease the occurrences, and mostly those formulas allowed him to have it sort of at a lower rate, but not really get to the core of it and move it out of his system. That gouty acid buildup, it's a buildup of uric acids from a certain thing called purines, not digesting so well. I'll talk about the foods they come from and how that acid builds in the gut excessively and how to remove it using certain Ayurvedic formulas. So this gouty buildup had been sort of in the background, and likely the main toxicity related to blood had been this condition, and had been going on subtly for 25 years and likely creating this repetitive inflammatory conditions. Those gouty uric acids need to move out of the pelvis, and that's why we see these pelvis conditions developing over time. As I track these symptoms now down to specific doshas, so I'll look at each symptom individually. So the first one of the pain and the can't walk erect, just the fact that he's in the later stage of life, any stage past 50 or past the hormonal peaks of life, we're in the vata stage of life. So it gives points towards vata for that symptom from his stage of life that the symptom is happening. Gives more points to vata because the symptom is in the legs. And if we split the body from the head to the feet, the legs are the zone that's more associated with vata. The condition itself is a muscle spasm, and to some degree, any pain condition is a little bit vata as well, but particularly a spasm that's affecting how the body's movement is, highly related to vata. A muscle that is spasming in close proximity to the colon. So here, the muscle that's spasming is iliopsoas, and the colon is the seat of vata. So if there's imbalances with vata, they'll likely influence muscles, organs, and systems closest to the colon first. The trigger that turned the pain was exercise and movement, again, worse for movement, showing a vata sign again. As the location of the pain is in the pelvis, it shows there is some form of apana vata imbalance. This is a type of vata, a movement intelligence that controls how the body moves things and in which direction. This specific one, apana vata, is related to the downward moving intelligence that is predominantly in the pelvis. It controls the elimination functions of both colon and urine. It's highly related to the body's detoxification intelligence and whether or not it can intelligently choose what I need to get out through liver, gallbladder specifically, downward movement of gallbladder, colon, and urination. Intelligent. What do I need to get out? What do I need to keep in? Some dysfunction of that intelligence in the body, the fact that acids have built up and been kept within the pelvis and the lower parts of the body. So as apana vata controls elimination, this highlights the need to check for toxins and support elimination. So straight away, our first symptom in the pelvis related to the psoas, we need to check. How's colon? How's elimination? How's armor? Half digested byproducts that could be creating a toxic overload of the elimination areas. The next symptom that we look at is the repetitive inflammatory conditions after exercise, weeks for the pain to go away, particularly how I saw the red through there. It looks to be a bit more pitta, looks to be signs of toxic pitta influencing the blood, with redness on the skin and repetitive injuries in the soft tissues around the joint. So that pitta, when it's hot and sharp and penetrating, and if there's excess of it in the blood, it can move into those microchannels that are around little joints and the ligaments and tendons, and those areas generally don't get as much circulation into them. So it's that hot, sharp pitta that can penetrate there easier and then get stuck and create more heat, repetitive, inflammatory, particularly if there's exercise and there's already a bumping heat there, then it can over pitta the joint during those times. And we generally see that as some redness in the area, at least some heat. And if we see a combination of that with injuries in the soft tissue, it leads us towards think about toxic pitta influencing the blood. Our next symptom, the gallbladder, backs up this possibility of toxic pitta influencing the blood. And now we have one of those apana elimination related organs, downward movement, that can come from the gallbladder. It relates to both apana vata, the downward movement from the pelvis, and samana vayu, the horizontal movement for the digestive tract. The gallbladder is both there. So it highlights, again, metabolism, samana vayu, horizontal movements in digestive tract, and apana vayu, elimination issue. The moment someone has that removed, in some ways, the intelligence that moves things in and out of the digestive tract is slightly not working as well, samana vayu, and the intelligence that moves things down and out through gallbladder, colon, and urinary is also not working as well. We're going to need to support those areas in order to maintain healthy function of the rest of the tissues of the body. And what we've seen is there wasn't necessarily the support needed after this was removed in 2005, and then that's led towards the build-up of these acids and continuing the rest of the conditions that have gone on. And, pitta, often related to toxic pitta or kapha, moving through the bile and or stagnation with bile. It highlights an imbalance in fat metabolism across the body, often from high kapha or high pitta. The more intense and sharp the gall attack is, the more likely it is from aggravated pitta. So his was that intense, sharp, needed surgery to remove it quickly. And then our last symptom of gout. Gout is often related to excess pitta, ama, these half-digested byproducts, and metabolism issues. If they're not digesting and eliminating purines well, that's a product that's in many meat-based products largely, and I'll talk about a few of the key meat-based products and other foods, and creating excess uric acid. When we don't digest this well, then we end up with more of this as a byproduct from that. Then also allowing it to stay in the tissues, and particularly in the legs, which shows some vata dysfunction as well. So pitta and vata is key to this gout condition. The gout condition in Ayurveda is known as vata rakta. So here we have a specific name that has many of the symptoms associated with what we in Western medical science call gout and this uric acid building. And the name here already highlights vata in some way. And then it looks at rakta, which is the second tissue, the blood. And we'll look at understanding this relationship between how the doshas, vata, pitta, and kapha, influence metabolism. And then from there, that influences how healthy are the tissues that we end up forming inside the body. So these doshas, vata, pitta, and kapha influence metabolism, and then that influences how the body builds itself. And particularly the name of this disease, vata rakta, is highlighting that some original vata, exhaustion of the body's resources. Here we have an athlete that would have been pushing his body hard, pumping. There was rajas, desire, go. This vata exhaustion of the body's resources has then allowed an imbalance of metabolism in blood, imbalance of elimination of what needs to be eliminated from the blood, and that's created toxic rakta, blood. It doesn't necessarily mean, if we look further into vata rakta, that all gout conditions are 100% related to vata at all. If we look into the classical text, vata rakta as a condition could have many vata signs, pitta signs, or kapha signs, depending on how it's influencing the blood. But what is definite is that vata has influenced the metabolism of fluids and blood. In some way, it's disturbed and made that irregular. And then that could mean now excess pitta and kapha are building up in blood and the rest of the tissues because of this disturbed blood. That's the key highlight. Disturbed blood has then meant the rest of the tissues become imbalanced, and in some way, often exhaustion or major stress is the trigger at the beginning of this disturbed blood, vata. These are tracking the doshas back towards tracking the symptoms back towards their dominant doshas. Any questions on any of that? Happy for me to proceed through there?
Yep, happy to proceed.
Now we're looking at his daily routine. So I ask what they do in the morning, the first thing, what they may eat or drink. He has a piece of fruit, an orange or mandarin or watermelon. He goes for a walk, he does some exercise normally, but since the back, he can't really do anything. He's reading on a tablet, mostly eggs on toast for breakfast with avo and feta or some porridge, sometimes yogurt and fruit. Clear soup Asian style. His wife is Asian and they tend to have a few Asian meals as well. Big breakfast with sausage, eggs, mushroom, tomato, sourdough. What I tended to notice as I went through was a lot of bread. There was bread repeated in various things. Pancake like a gluten-free with avo mash and feta. Tea black with xylitol and stevia. Water, lunch, usually a bigger meal for lunch, a curry or meat-based with salad, dumplings, Asian style, quiche if not having eggs in the morning, stir-fried noodles sometimes. Dinner is often lighter, like soups and stir-fried noodles, Asian soups or pumpkin soup, or sometimes meat and mashed potato and steamed veggies or pan-fried fish. So we see in general a pretty healthy diet, fairly across the board, a few excesses and a bit more on the abundance side of things. Even though he's had gout for a long time, he is cutting back on those red meats and wines and things that may promote more of that challenging gout condition. He's not eating the seafoods that may create as much purines that are needed to be digested. However, it's still a fairly rich, abundant, full diet. And his solution to that over time has been intermittent fasting. He still eats fairly decent big meals with a good amount into. Occasionally, there's these lighter style things, but most of the time, each meal is heavy and possibly, therefore, overloading metabolism as a regular thing. The tongue, as we start to look and try to confirm, do we see a relationship between the causative factors that we think here in the lifestyle to what's happening inside the body? And therefore, do we see that relationship now as what we can see on the tongue or the eyes or touch with the pulse? In yoga therapy level 1, we focus on the tongue, particularly because it has a strong diagnostic relationship to the digestive system and metabolism. And here we have a metabolism issue with gout and the various other things we've seen related to inflammation and blood. So the tongue is a key diagnostic organ. His tongue was thick, swollen tongue with signs of a thick coating that appeared to be in the tongue. So when we see that the ama, the half-digested byproducts of the body that are over-circulating, are not just on the tongue, but in the tongue itself, it shows the ama has settled into the deeper tissues. Beyond fluid and blood, it has settled into mumsa, muscle, and possibly further than that as well. So then we know the ama condition has been around for a longer period of time, may require more time to treat to be eliminated. There are teeth marks in the side of the tongue showing some lymphatic swelling through the digestive tract, that the lymph is not flowing on either side of the digestive tract. It means the immune system is not going to function as well, and toxins are not going to be drawn away from the digestive tract as well either. There's a redness around the edges of the tongue, showing some pitta that's trying to be thrown out towards the skin and the edge of the body, and the need to move excess pitta off. This backs up and confirms the redness that we see on the skin. So then we're like, okay, you see it from the metabolism of the tongue right out towards the skin. There's that pitta moving through the tissues is very likely. It confirms my suspicions of excess armor, possibly stuck in the tissues for more than 25 years since his 40s. Signs for all doshas aggravated his case, but also seems to confirm the blood aggravations and toxic pitta in the blood. Looking at his eyes, there is some redness in the white of the sclera, also indicating toxic blood as well. For students, if you are uncertain if armor was present, then it's worth doing the armor test. It's a resource we use for our ThaiVedic students, and you'd be able to download that at Kimmana.com. Which treatment plan did I prioritize and why? And here I look at 3 different sessions that I did with him, and I explain why I start with this and what the direction that I was moving towards. So first I'll just give the big scope of the 3 sessions, and then I'll explain what I did within each session. So the big scope is just first I started with pain relief. It's like focus on his pain and his immediate symptom that's only within days, and get immediate relief on that. And because it's a vata related symptom, I know that touch and body work, the sense organ of vata is touch, can have a quick influence on that movement and circulation and that spasm. A soft and gentle bodywork session, really focusing on balancing the vata. That was the first session. I'll come back to explaining what I did in that session. In session 2, we went deeper and we went using oil on the table and a steam box after the session. So we were able to already free the spasm to a certain degree, and we're now getting the oil to change his tissues inside. And in session 3, after I got the physical body in a condition to really sort of relax a bit more and open and walk, then I started to treat the mind. I didn't want to overload the mind with a whole consult of do this, do that, eat this, while there's already that pain and vata present in the body. And I saved the consultation where I really explaining lifestyle treatment, a lot of that, to here. I just gave tiny little exercises and like 1 or supplement or something in the first session. So 1 supplement is what I did in the first. So directly, the bodywork session allows us to quickly influence vata, movement and circulation. And 1 supplement, Rasnai Randadi Quatham, was the choice here to help with improved tissue metabolism, elimination of blood toxicity. It's a very specific formula for pain, any pain in the lower extremities. Bodywork will be on the ground with lots of osteopathic harmonics of the iliopsoas, quadratus lumborum muscles. These muscles I'll show a visual of in a moment, and they're the key muscles that are involved in his pain, and being able to address them with a harmonic movement, a gentle, subtle pulsing and rock, allows the circulation to move deeper into the body. And then sitting on the legs in various postures using pillows and supports to deal with mobility issues, particularly because he couldn't just extend his legs out in front of him or lie flat on his back. We had to support through quite a few different ways to allow him to keep the iliopsoas slightly bent in its shorter position and not be as long. So laying in side position at times to do the leg sits, etc. I'm just going to welcome Natalie here to the session. Hi, Natalie. As we're going through, you're welcome to pose any questions as we go through. We're doing a case of mine, and the case is iliopsoas pain. I'm explaining the 3 different sessions that I did with him, the first session being bodywork as the focus. I really could barely move his body without much pain, so we got him into a position where we were able to do the harmonic of the iliopsoas and these 2 muscles here. What I'm going to do now is I'm going to get rid of the share screen and do a little visual of a body and how I addressed that harmonic on him exactly. Imagine this pillow is the torso, and that is the head that's up there. And then I've got their two legs right in front of me like this, just as if I was here and the head was there and the legs are up like this. Yeah. I then can have one leg long and I can come in close towards this leg. The foot is about 1 foot away from the buttocks. The practitioner then comes in to a very well-known position to be able to extend that leg from the knee. But the amount of engagement is so subtle, so minute. We're just engaging the knee in this direction and then creating the smallest possible harmonic pulse on there. Very, very minute, very, very subtle. And these osteopathic harmonic techniques are the techniques that get the quickest results for a spasming muscle to turn off and relax and lengthen. So particularly addressing his spasm, I didn't want to take it too far. I didn't want to stretch the muscle into long lengthening. I just engaged it the tiniest bit. I spent at least a minute pulsing in that harmonic. I slowly release, and then sometimes I did it again in a slightly different engagement or length, and I just pulsed again there. I did that many times in these positions with both legs. And then I moved to sitting on the legs and just fully compressing his legs with various wind gate procedures to push the circulation deeper. And then I'd bring him back to this position again. It took about 30 to 40 minutes of the session, and then he could extend his legs much more. And I was able to do sitting on the legs with his legs way more extended with him on his back. Amongst that time of the harmonics, I also turned him onto his side position. Imagine the legs are bent out in this place like this, as if the person was on their side position like this. And now I have access towards this side of the ilium. I'll show a video after this, a picture, I should say, after this, of the iliopsoas and where it attaches here. This top of the pelvis here, and being able to grab this part of the pelvis, gently push away. And the practitioner is sitting directly behind the person with their knees towards the direction of the ilium here. So they're parallel to the body, able to create this tiny bit of length down the side of the pelvis, and then just pulse, a harmonic pulse that's there. This is something that Natalie has learned within the ThaiVedic 200 hour, those harmonic techniques, part of the training that we're about to do right now in Thailand. They are the most specific two harmonic techniques to address any spasm in the lower back, and particularly if the person can't really walk or move into a position easily, then it allows them to have both knees bent still in that first harmonic position and allows them to have their knees bent in the side position too. So it allows us to move and do body work on a person that's in full spasm and slowly release and bring circulation into the area. That combined with wind gates of the legs, various sitting procedures on the legs and around the pelvis, massively drives the circulation that's needed into those deeper tissues, because largely, particularly an iliopsoas spasm, is often related to a challenge in circulation. And we've seen that that was a key highlight for his condition as well. The quick onslaught. And then continue here, sitting on the legs as I explain. This will improve circulation to the pelvis, help restore flow through microcirculation to deeper tissues like the iliopsoas and its attachments, send repetitive water rocking pulses through the nervous system of the iliopsoas nerves. There are two specific structures inside every muscle of the body related to the nervous system called the Golgi tendon and the spindle cell. And that rocking movement in a very, very small way, where the body is continually kept in some slight amount of tension, not rocking in and out of tension, just a minute amount of tension, is where that spindle cell and Golgi tendon will turn off the most. I'm going to share my screen again now. And give a visual of that iliopsoas muscle. This is just a picture I looked at straight away from the internet here. So notice that we are in fact talking about two muscles that have the same area of attachment, the iliopsoas muscle, that one that comes towards the lower back and attaches all along the sides and the inside of the lower back here, comes through the whole pelvis and loops, attaches on the inside of the lower leg we see there. And then the ilium bone is this side of the pelvis here, the ilium, and that side of the pelvis, that top ring. They call this the iliac crest, that top side of the pelvis. And we can see that the other part of the iliopsoas attaches here on the whole inside of that iliac crest. So as we have them in side position and our hands are here right on top of that iliac crest that's there, and we're just lengthening this away from the body, can you see how we're actually creating this pumping action between the two aspects of the iliopsoas muscle here? So we're bringing that needed circulation in through this whole muscle here, and vice versa. When we have the leg bent, we're then just pulsing into very specific parts along the main part here that goes up into the lower back. So they're working on the iliopsoas in two different ways, these harmonics. One is much more from the top of the ilium, creating the space and the circulation through here and these attachments, including another muscle called quadratus lumborum that goes up into the spine and the rib cage there. But the other one, as we're down here on the leg here and we're pulsing from the knee, is much more specific for the part of the iliopsoas that goes up into the spine. The spasms in these muscles are most 80% of lower back pain that's holding the person in a strange posture, particularly if the posture's forward. This is the area we need to work on. So we focused our first session very specific, down to a specific muscle with a very specific bodywork technique that we filled a huge amount of the first session with. It's not as general as we go through. How I have applied in a general sense is I've realized that there may be an AMA toxic buildup in the body. So I've used a supplement here called Rusnai Rundati Quartham to help move out that toxicity in the lower body. In the second session, we went into more, now we want to repair this tissue and the blood a bit more meaningfully. We've been using this formula for a week now, and they've come back in for another session. I think it was maybe 5 days afterwards. I prepared a medicated oil specific to help remove this excess pitta from the blood and remove AMA from the microchannels, digest and metabolize toxicity, which may be stuck around the ligaments and the tendons of the body. The oil specifically I chose is Pindatylum, 80%, a very nourishing blood-specific oil, and then Carparati, 20%, a very clearing oil, specifically for microchannels that are blocked and fluid that's stuck anywhere in the body. Carparati is a great oil of choice. These mix very well together because Pindatylum is extremely thick and super nourishing, and Carparati is a bit more penetrating and clearing, and that combination is a good combination for many people, especially when we have toxic blood that needs to be cleared. Client was already walking much better before this session, yet the day after this session, so different to when you do the body work without oil and it's like, oh, the results are right there. It's like nervous system, boom. But with this oil technique, it's more in the tissue long term. It was the day after that he noticed the big changes. He felt the systemic low-grade pain shift, not just the psoas where he was and a bit easier walking, likely because the blood was cleaner. Now, I've really highlighted cleaner here because what most people do is they go, oh, my symptoms are getting better. Key pain's gone away. That's good enough. Let's just continue with normal life. And then it sort of comes back again rather than, oh, I really need to get the blood clean, which is very different to cleaner. And it can take months, particularly if there's conditions like AMA, half-digested byproducts that have been very deep-seated there for a long time. Then educating the client on this slow, gradual process that's needed to not just get rid of their immediate pain, but to give them full mobility again, that they could be doing things like surfing again if they are able to follow a plan for a period of time. and commit towards some form of long-term plan. So here, full 90-minute consultation is the next step for that, as they're already aware of some results and that we could go deeper. Now, my tendency is I give some diet, herbal medicine, and lifestyle advice within each session. In this session, I mostly explained the concept of Agni and Ama to him. So I always explain some form of traditional medicine concept to the person so they can start to use balance in their life. That's the key way for the traditional medicine concepts. And here it's a very simplistic one. It's like fire, heat, and metabolism, or dampness and blockage in some ways. This is the polarities that we're looking at here, and that he needs to balance this because his metabolism can only take so much before it creates, as an example, uric acid and gout inside the tissues for his symptoms that he's aware of, but there'd be many other half-digested byproducts that he's not aware of. We've just labeled gout and found one of them. I then go into how there were certain foods and lifestyle practices, which although may be highly nourishing and very enjoyable, often, if done beyond digestive capacity, will create half-digested byproducts circulating in the tissues, and this leads to his repetitive inflammation. So I teach him about the relationship between circulation, half-digested byproducts, and how that could be making his immune system need to clean up those half-digested byproducts that are floating around the body. And as the immune system's trying to clean that up, that it only cleans it up through the process of inflammation. Really, we should call it tissue digestion. The process of tissue digestion, as it's digesting old challenged tissues or digesting half-digested byproducts, blocking circulation, the immune system has to inflame it and repair it and break it down. The most likely foods from his diet, which had not been considered. So he'd just been really focusing on uric acid and gout. So he was like, oh, I'm going to cut out wine and cut out red meats and cut out tuna. And if I do that, then my gout's sort of at bay. I can take these other herbs and I don't get so many attacks. It's sort of good enough that's there, rather than looking at Ama as a whole and going, oh, maybe the uric acid's getting stuck in the beginning because there was Ama, half-digested byproducts, and that there could be way more potential for his body to naturally detoxify that uric acid if there was less armor inside the body. So then particularly bread and sourdough bread, a lot of fermented grains have the tendency to build up armor. Now, they're also extremely nourishing and very enjoyable. Because they're fermented, we're able to get some nourishment out of that quicker and easier than other things, but they also leave a byproduct from that fermentation that our liver and blood has to deal with and clean up. And if we have toxic blood as one of our signs as we diagnose through, then fermented grains are an often contributor towards toxic blood conditions. So we'd have to cycle them and come off them for periods of time to make sure we can remove that armor and toxic blood. Yoga is another food with high potential to aggravate the blood, and so I told him to stop that as well. Particularly the mixing of yogurt with fruit is a high likelihood towards aggravated blood. I prescribed khichdi 1 meal per day and a khichdi fast 1 day per week, just keeping it simple for him, not trying to adjust the diet so massively, just going, these are the 2 most important armor foods I can see in the diet. And now just try to lighten up your foods by having a soupy stew regularly, and particularly a medicinal khichdi that focuses on enhancing his metabolism again. Because his pain was so much better for rest, I focused on yoga nidras before lunch every day. Because he has a bit of a rajusic constitution, desire, next action, they probably need to have a time for their yoga nidra rather than if you're getting tired. It needs to be like earlier in the day at this time, because they generally don't catch it before they're getting tired. Their dopamine or rush of adrenaline next go, it means that they won't notice that gentle tired need. His Pitta Prakriti, pushing most of his life, needs to rest more, regenerate vata, particularly because the condition of gout is vata rakta, often has some form of aggravating vata to the point of exhaustion component. Its deeper background causes would have been at one point, maybe as an athlete or other things, he's massively aggravated the vata. And he's a very strong mental power person Like as we go through, I did like very little focus on other styles of meditation practice because his mind is so strong. He's very positive and uplifted. And what that can sometimes mean, though, is they can have a strong mind and they can push themselves through major like exhaustion because of that strong mind, without necessarily noticing the more subtle effects of the body. And that's what I suspect happened possibly quite a few times in his life from his 40s onwards, where he was still trying to be an athlete at a professional level in that stage of life. So I saw that his fascia was really challenged. There were dryness, instability. As I touched areas, there was tightness, there was overlapping of fascia. So no wonder he was having these spasms and various tissue challenges. And when it comes to repairing fascia, it's the same approach that I did as bodywork. It's deep, slow, long hold compressions where we push all the blood circulation out of the microchannels through very long, deep holds, and then a release of that to bring blood back in. And the combination of that with these elastic, gentle, pulsing movements. And that's what rehabilitates the fascia most from a movement and perspective. We need to have the internal things to allow the mumps of the muscle tissue to rehabilitate itself. I'll talk about that in a moment. But in terms of like in the consult, giving him something to do to go home with, he can do that himself. He can do compression on one point for 10 to 60 seconds, then move to another point. Do at least 4 to 6 points each day. I showed him various different tools, whether it's tennis balls, cups, yoga blocks, and things that he could use to also compress into his belly. Because as I saw, part of the iliopsoas is accessible through that front part of the belly here. So he could have the yoga block on the ground and he could lay over the block in certain ways where it allowed the edge of the block to just gently press into the belly and then just fully relax himself over that yoga block. If the yoga block's too much, start with a tennis ball, start with something smaller, but a fully relaxing deep compression into the lower belly, the area where apana vata, the elimination, is highly influenced, deep, gentle compressions through this front region. And then we can apply that with anywhere you want those compressions, through the buttocks, through the sacrum, down the side of your leg, any piece of fascia, muscular tissue, the extended tissue that you feel like, yeah, I need more circulation in and out of that area. So do this regularly. Yeah, it's 4 to 6 points each day. And then we follow that compression straight away with elastic rebounding of meridians. Now, this is a by yourself example of the osteopathic harmonics of bodywork, where we are now using the body to get that elasticity and bouncing through the body. And I'll show you here on the video the two main ones that I did for him, particularly the front lower body and the side body are the key areas that I've worked with for him. So basically a low lunge position with one leg slightly behind. The toes are both facing straight forward. The hips are also facing straight forward. And then from there, we start to lift one side of the body. The same leg that's back, the same arm can come up, and we're just gently pulsing and lengthening through the front. Now, this would have been too much for him. So he only had a foot just here, slightly behind, and he lifted up one side. For some people where the spasm is even worse than his and they still haven't been able to get the relief or the length, it might be down on the ground here. And they're just placing a leg slightly back or long below them, and they're just pulsing upwards, arm up here, pelvis up, getting their own little elastic pulse on this area of the iliopsoas that's there. We try not to just pulse back and forth. That's too much for the body. We try to keep it in a little bit of tension and we pulse in length. So we're constantly just in the length. So this is the extreme on the ground. This is what most people can do, a little bit of a leg back. When we're healthy, for me, this is my harmonic for it is way further with the leg back. My right arm is still up in the air here, and I'm able to pulse into the front body. The iliopsoas, the meridian, is connected to the kidney meridian. And then the side body is with one leg behind the other, lifting up whichever leg is behind. So the right leg is back for me now. The right arm is going above my head, and I'm lengthening the whole side body. I'll try and get my upper body into this as well. Lose the lower body for a moment. We're lengthening the whole side body, and it's the up and pulsing in there. And again, it's getting that iliopsoas, but now it's on the side of the pelvis, more similar to like what we were doing with the side iliac pulse in bodywork as well, through this lengthening side body. These style elastic rebounding movements should be repeated 21 times for each one of those pulses. And then I gave him a strengthening exercise to consolidate the fascia, doing a spinal balance exercise where we are in all fours. We're extending one limb out in front and the opposite leg behind us is the pose of spinal balance. Only after doing the above for at least a week, then start to move to lengthening squat, focusing on inner thighs back and side body long in all strength poses. So here I then started to extend him. I only moved into strengthening once he could already get some movement through the rest of his body. Once he could consolidate his core, I gave him a spinal balance exercise to bring strength to the core first, before I then got into any long limb movements of strength. Which is often the case for athletes, particularly certain ones that have been focusing on the outer limbs a lot within their sport, then that tends to be limb excessive rather than core dominant. The core should be the strongest first. So then I move into one-legged squatting, just keeping that length through the whole body and keeping the hips as aligned as possible, lifting one leg off the ground. And then from there, only just going down as far as you could, keep length through here, come back up again. Really, it's a balancing exercise more than a squat exercise as the focus. It's about keeping them balancing on one leg and gently squatting. And this really helps with a lot of the stabilizing muscles of the lower back. We used a detox khichdi recipe with it. We focused on lots of lime and lemon juice. This helps to digest fats, and particularly because I saw that fat metabolism was key for this client, so lime and lemon juice is very supportive there. There is an example anti-inflammatory diet, which I've placed into the student resources folder for people that have signed up to these case studies and mentorship and a part of the paid program around that. In here, I have this inflammation smart diet. It's a resource that I created for a different client who had a specific gene test done, but it's still general to what causes most inflammation. And it's just, if you have this gene, then you especially need to be aware of this. But in general, this is the direction of what causes a lot of inflammation across the body. It highlights two different genes at the bottom, one that's more systemic inflammation, one that's more gut and nervous system inflammation. If people do these gene tests, they can know specifically, but any of this is still going to help with inflammatory tendencies across the body. So I've given him this resource, and if you're interested in it, it's inside the resources for the students that have paid for this. For people that are here within this group, you've paid for it already, so just ask Elite and you're able to get those resources. Now, this Rasana Randadi Kwatham is one of the reasons I wanted to do this case as well. It's a very successful and useful formula for pain conditions in the lower extremities, pelvis, knees, and pain in that area. It has a good amount of a herb called Sahachara in it, which is specific for improving circulation into the microchannels of the spine. So any spine imbalances it could be useful for. I've told him to take the full 2 packets you have before moving to the below. So I'm doing a switch formula on him where I do 2 months on this, clear, more Vata related pelvis and armor. And then this deeper pitta and armor that moves into the bone tissues, whereas this formula is more, although it does work on deeper tissues, it's very much for blood and muscle. And then it works towards bones too, whereas this is blood and bone as it moves deeper into the body. So this allows us to clean out the armor over a longer period with formulas that focus on eliminating armor. It could be used for gout, and uric acid is one of the formulas for this, one of the uses for this, I should say. It also has herbs in there like Ativisha, which are antibacterial and antifungal. It starts to look at the relationship between colon and how imbalances in the colon are often seeding, and this toxicity coming from Vata in the colon. So it's a key formula whenever there is Vata related to pain in the pelvis, and it's a balanced enough formula that we can use it with Vata, Pitta, or Kapha. And particularly this case where we see all 3 doshas that are aggravated, it's a key formula to think of first, Rasno Randhati Quartham. These Googaloo formulas tend to have a lot of specifics around who can take them, when to take them, compared to Rasno Randhati Quartham, that is more tridoshic and mostly can just create some digestive imbalances if not taken at the end of a meal. So I tend to just prescribe it at the end of a meal whenever I'm using it, and I haven't had any imbalances with people in my time of using it now. It's been a great formula. It's not considered a long-term formula. It's a 2 to 3 month maximum. Get circulation moving, get inflammation modulating, working better, do exercises for the lower back and improve the muscle tissue during that time through exercises while we're building up fluid, blood, and muscle. That's the case itself. Is there any questions on what we've gone over in the case and the 3-session plan? And to wrap it up, I'm just going to put that into what we do each time with the case studies. We put it into this 5-element process, and we look at it again through diagnosing and just rehash it all here with a PowerPoint. So basically, these are the conditions we've been looking at. These are the doshas, all doshas with armor. Whenever we get half digested byproducts that build up, all doshas are very easy to build up. Why do we see all doshas? So the constitution is there, 68-year-old man, athlete before his 40s, medium build with a stocky muscular features. This shows tendency to Pitta and Kapha, the athletic, medium build, the stocky features. He's able to skip meals easily as well, shows a tendency to Kapha. Pitta and Kapha are the dominant doshas. This, in my mind, straight away goes tendency to hold excess in the body. His constitution, having Pitta and Kapha, could hold excess, whether that's heat, or fluid, or dampness, or heavy, or excess proteins, in some ways, excess. Then the vikarity, the present imbalance, we see Vata, Pitta, and Kapha, likely because of armor, half-digested byproducts. Why do we see that? In the order of priority, we see excess armor from bread, dairy, and abundant life has allowed all doshas to get stuck, mostly in the elimination organs where armor often accumulates. Vata has caused movement and circulation imbalances in the pelvis and the elimination organs, particularly Apana Vata, the downward moving energy of Vata. Repetitive knee pain, psoas shortening, dryness on feet and knees, muscle spasm in the pelvis and the lower back. So here we see movement and rest as the key qualities and dryness as the key qualities with that Vata. Excess Pitta has caused transformation imbalances in the liver, the gallbladder, which has been removed, his blood, the mitochondria, the transformation inside each cell, leading to an acidic buildup in the blood, repetitive muscle inflammations, and red skin. These hot, sharp qualities that we see building up here. Excess Kapha has slowed all body functions, decreased his appetite, along with the armor would have decreased his appetite. There's a thick and a large stool that is slow to pass. So he didn't necessarily say he had any digestive imbalances in elimination or stool. But as I probed, I then discovered that it wasn't necessarily the easiest to pass. And he did go to the toilet each day, but it was always on the thicker and larger side. Again, signs of kapha that are there. There was a white coating, and some of his symptoms are worse after eating, especially gout-related symptoms, worse after eating something. Gout gets created. Triguna, how is the psychology being directed in life through the trigunas, is likely rajasic for him. But in this stage of life, he's starting to move to a lot more sattva, prepared to listen, take on the information from teachers and guides. He's trying to meditate quite regularly already. He's in a stage of wanting to really listen to his body more, compared to the dominant rajas that his natural constitution probably is, that would have been stronger during the pitta phase of life and when his hormones were higher. The diagnosis of the tissues, so we look at the signs and symptoms related to tissues, is that this ama, this half-digested byproduct, led to blockage in circulation. And this created false signs of deficient tissue. This allowed his dominant aggravated dosha to get stuck in many tissues. So what I mean by that is false signs. Let's imagine that ama, these half-digested byproducts, they're floating through, they get stuck in the pelvis. And then because of that, less circulation can move from the torso through the pelvis down to the feet. So then we get in the feet signs of dryness. Like in his feet, I saw that there were dry feet, dryness around the knees as well. But the rest of the body didn't have signs of dryness. The rest of the body had a full belly. The rest of the body, the skin was moist. I could see oil on the face that was there. So it was that the circulation wasn't moving it. False signs of deficient tissue is what I'm saying there. False signs of deficient rasa. The rasa was deficient. The fluid was deficient in the pelvis, though, not necessarily in the whole body. Not that we needed to build rasa up. And it's one of the reasons why I want to highlight this case compared to some of the case studies that we've seen from the students, is that many of them have been a very deficient caused, whereas here we have excess caused leading to ama, half-digested byproduct. It still may be showing some deficient signs in tissues, but where is that deficiency? Just in the vata zone of the body, in the legs, in the toes, in the psoas, in these areas that are closer to vata is where that deficiency is starting to take place. But the original cause is excess and blockage. And if we relieve that, we can allow that nutrition to flow across the whole body again and nourish the lower portions, including the psoas. So pitta and vata in rasa, this pitta and vata influence the fluids. I saw there's redness of skin in places and dryness of the legs. Fatigue is a sign of aggravated rasa, particularly deficient rasa or vata in rasa, and particularly when he used this muscle, the iliopsoas. So it showed me this rasa, this fluid, was not penetrating into this muscle at all. That's what caused the fatigue. Vata and pitta in rakta, so then each tissue influences and affects the next. From here, the fluids then affect the blood. The redness was not just like on the skin surface, but it seemed like it was deep in the skin as well. Now we know the pitta has moved to the blood area. The redness was also around the knee, where he'd had repetitive inflammations in the past, and particularly soft tissue, tendon, ligament areas around there. Around the back and the shoulders, tiny little dots of redness through there. Generalized inflammatory conditions, burning sensations when the gout was coming around. He would have had bile stagnation or stone that's led to the gall attack. These are all signs that blood is becoming imbalanced in some way. Generally, pitta in the blood leads to these bile stagnation, generalized inflammatory conditions, the redness that we see. Yet, because his condition is gout, and gout is known as vata rakta in Ayurveda, we see all these pitta-related conditions, but we know in some way vata was the original trigger that created the seeding of this metabolism imbalance in blood. And because his constitution was naturally pitta dominant, therefore he already had an excess of pitta in the blood that was circulating at those times of vata aggravating imbalance in the blood. It was like, oh, it's just so easy for this pitta to now dominate there because vata is no longer effectively moving it out of the blood. When that goes on for too long in the blood, Then we start to get challenges in the next tissue, the mumsa tissue, the muscle tissue. We see signs of mild deficient mumsa, but mostly it's vitiated mumsa with excess pitta. The pitta dosha has aggravated and overloaded the mumsa tissue. So here we see the signs: repetitive inflammations of tendons and ligaments, burning sensations, muscle twitching or spasm, aches and pains, depleted fatty tissue only in the legs particularly. So here that the muscle and the fat tissue are highly related to each other. The rest of the body had more fat tissue on it. If you looked at his legs, you wouldn't have gone like, oh, they're depleted in any way. More just if you compared it to the rest of the body, it's like, oh, I can see the fat is not evenly distributed. There's less on the legs. The muscle tissue in some way is not as vibrant through the legs as it could be. And therefore we see vata is now moving into mumsa, and particularly with all these heat related things, that toxic pitta in the blood is now influencing and challenging the muscle tissue, making it so difficult for him to exercise without inflammations taking place and challenging his body, and likely been there for 25 years. How do we deal with that? We help with 5 different domains of life related to the elements as a metaphor. The first one we look at is spirituality and guidance. We want to help him to guide himself. We give him knowledge of medicine. I focused on Agni and Ama. We then give him some form of Raja Yoga, meditative stillness practice, so they again can listen to their body better and guide themselves. I gave him a laying meditation of a Yoga Nidra before lunch each day. I didn't give mantra practice for this client. I felt his ether element was pretty good. I also didn't focus so much on the mind, touch, and relationships. In general, his nervous system and his mind and how he was doing was quite positive and in a good space. What I did focus on was touch therapy, because I could get deep circulation techniques for the psoas and the pelvis very quickly. I did the gentle osteopathic harmonic techniques of the psoas. I focused on the wind gates of the pelvis and the legs. I did harmonics of quadratus lumborum in side position as I demoed in the video. I did more wind gates of the legs and the pelvis. And then with the rest of the sequence, now his body was able to move enough that I could then focus on the general Vata balancing sequence he used in ThaiVedic, general focus on kidney and bladder meridian, which is the most connected to his immediate pain and spasm. So I went from very specific back and forth, lots of communication, moving him into positions to get that relief in his muscle to, now let's just give him a good bodywork session for the rest of the session and focus on the meridians, the bigger association to the rest of the body of what his spasm was related to. So kidney meridian running through the deep front related to the iliopsoas muscle, and bladder meridian running through the superficial back, a key pair that is highly influenced from Vata dosha. So I focused on that in the first session. This is where his issues are largely related to metabolism and exercise. So this is the area where I put a lot of energy into. The formula Rasna Randhati Quartham to improve deep tissue metabolism in the pelvis and the legs. He's a larger man, so I was able to give him 2 tablets after breakfast and 2 tablets after dinner. I consider him safe for this higher dose end. The alternate to this, so not at the same time, but once they finished that, was the Kaishora Gugaloo. After 2 to 3 months of this, and then moving towards the Kaishora Gugaloo. Unless you've already checked with me or you have a good understanding of medicine, then don't prescribe the Kaishora Gugaloo until you've talked to me before, or any formula with Gugaloo in it. But it is a deeper tissue cleansing and deeper into the ama, and particularly into the deeper tissues of bone and nervous system, and how they influence pain response through the body, how pitta, toxic pitta from the blood, may have built up and established itself into these areas, and drawing that out slowly over another 2 to 3 month period after he's gone through the Rasna Randhati Quartham. I would expect there would be massive changes in his body. We've already seen massive changes in his body in the 4 weeks since he's been taking the Rasna Randhati Quartham and the bodywork and the consultation, but a lot more to come. In the therapeutic alignment, I talked about the fascia regeneration process that we did. We're looking at how first we want the fluids and the armor to be flowing. Then second, we do compression. Third, we do elastic rebounding. That's the key. And then we bring in some form of strength exercise to consolidate and strengthen the area. So this is at home stuff they do themselves to repair their body. And I explained that in more detail in the video earlier. I did ask him to do an Abhyanga practice after his second session where I rubbed him with oil. I then gave him that oil and told him to continue that and use his own steam box after the oil each time. When he did the session with me, I rubbed him with the oil and then I put him in a steam box. For water, chemistry, and culinary, I just wanted to make sure he's getting some good clearing lemon juice in the morning, particularly because of fat metabolism issues. I didn't want that sticky fat to possibly be on the side of the digestive tract throughout the day, and therefore not enabling him to absorb through the lymph as easily. And as we have lemon juice and or things like apple cider vinegar, you can alternate to this, 10 mils of apple cider vinegar in warm water. These clean away the fat residues that may be along the side of the digestive tract, particularly useful in the morning to do these practices. And although vinegars can be warming and aggravating to the blood, particularly apple cider vinegar is very positive for the blood and cleanses the blood well, and is often used as a remedy for gout conditions as well. I then focused on starch, too much fermented grains, switched to more boiled grains, fruit, made sure it's away from meals, stopped him mixing it with yogurt, and I focused on an inflammation smart diet as I went through before. For oil of the body, Abhyanga with the Pinda, the Karparoti to clear blockages, support healthy blood metabolism. I get him to rub that on and then get into a little steam tent that he can buy and have at home himself that he now uses. Earth for timing, I gave him specific times to do the things. Daily routine, take the Rasana Randhati Kwatham directly after meals. Specific time to do his elastic fascia restoring exercises and standing on one leg. Specific time to do his yoga nidra. I made it time specific before or after something they're already doing, so it enables it to be an easier habit practice. And then because the armor is fairly deep-seated, I think he needs something a bit bigger in the long run, maybe a few days of each month where he's doing a khichdi fasting to assist, or possibly even a yearly routine where he's doing a panch karma, a deeper detox to really address some of those deep-seated tissues. Could be useful for him, particularly if we're not getting rid of all of the pain over time, and if he's getting some results from those cleansing practices and this khichdi program. That is the main process that I put him through. And the last piece is the lab tests. The organic acids urine test is a functional medicine test that is my first test for so many people because it's the best metabolism test across the body. How is metabolism doing? And is the metabolism influenced by bacteria or fungus? What toxic byproducts are not being eliminated from the body effectively? It's also going to tell me how much gout and uric acid might be present still in the body as well. I wouldn't do it straight away. I'd do it after a period of treatment to see how the body's responded and if there's more to do. I also recommend certain DNA tests for people as well to check what are your genetic tendencies. If there is genes that are promoting excess inflammation, then there's a good chance we need to try and counterbalance, neutralize those triggers, turn off the tendencies of those genes as a regular pattern. And understanding that specifically allows that. So I've recommended these DNA tests to him to check for inflammation genes and also to check. They can check genes that are related to side effects from medications now as well. There's quite a lot of study into this field that's going into the area of pharmaceutical medications and the various different genes that have had the most intense side effects over the years, and then also which genes have the least and get the most results in relation to those pharmaceutical medications. So particularly this client who's been taking statins and has been wanting to reduce them, has reduced them with the like combination of support from his doctor from 80 milligrams per day down to 10 milligrams per day. So he's been able to reduce them substantially. And this MedCheck panel could help us to know a little bit next level on whether or not, how useful, what other possible side effects may take place because of statins in his body. So the testing is, again, not 100% necessary. If we focused on just this testing, then we get very specific things to do. And we'd miss out on the beautiful general medicine of Ayurveda, of starting with the doshas, the lifestyle medicine, cleaning the blood through removing armor. That is the big general stuff that needs to happen first. And this style testing is for next level specificity for certain clients that want to go there, or for doctors that already know this and are wanting to learn the opposite, how to treat more generally and treat in a more holistic way and not just be focusing on the very specificness of lab tests. That completes our case for today. Are there any questions that we have from our students? None from Natalie. Any from Usmi or Ivan? And then we'll
so has it been a month since he started the treatment?
I look back at the specifics. I think it's 5 weeks now. And I'd spoken to him 3 weeks ago.
And
no, 2
his
weeks ago, he was 3
pain
weeks.
levels, his pain levels and his body posture and gout, all that's improving.
Massively improved. From the first session, we already saw big improvements. And then from the second session, dramatic improvements. And then when he communicated with me after stopping the bread as well, he noticed a large difference in his general pain across his body. So I think we're going to notice improving results over the next 3 to 6 months continually, providing that he continues to apply some of the therapies.
Yeah, what kind of bread was he eating?
Mostly organic sourdough from a good quality bakery. It's just that it was at almost every day. There was at least one meal with bread, sometimes 2. If there was ever a meal that he was making himself, mostly it was bread involved, whereas his wife would make meals that had other. So it wasn't necessarily the quality of the bread. The quality of the bread was good. It was just the quantity and the symptoms. If someone was having that quantity and there was no armor in the body, then I go, oh, their metabolism's functioning fine and they're eliminating that quite well. Sure, it might not be the healthiest thing for them to have that as their constant source of bread and fermented grain, but they're eliminating it well, so it doesn't matter so much in the bigger picture. But for people that aren't eliminating it as well, then boiled grains or flatbreads like a chapati, these sorts of things will tend to digest easier, particularly for blood heat aggravation, fermented grain. No good.
Right. I was really interested in the Rasnai Kwatham medicine, in particular how it targets the lower body. How does it do that?
There's a few different ways in how a medicine targets an area of the body. So the first is that each different herb inside a formula has a natural orientation of where it tends to move and have its predominant action. So they have an orientation depending on the chemistry inside where it promotes circulation towards or not. As an example, chili tends to promote circulation upwards towards the head and outwards towards the extremities. The ginger tends to have a very even promotion of circulation that is both in and out. It's why it's tolerated by so many different people. Galangal is a formula, a herb, another root, a sort of relative to ginger, and it's very specific for drawing circulation downwards inside the body. It has an effect on a vasodilation and relaxing arteries to open up, particularly in the lower parts of the body. It also does this inside the spleen, which allows, when the spleen relaxes and opens up, it then allows a lot more fluid to be stored in there. which then means we've got more fluid that can be stored in the overall body. So by applying galangal, and the way that they found this out originally was from people with bedwetting disorders, and how they could give a good dose of galangal at night, and that would relax the spleen and the bladder enough that they didn't need to go to the toilet as much overnight. That's more of a modern study. Ayurveda was aware of these general properties in the pelvis and relaxation and downwards. So the formula's key herb is galangal, that then allows that focus on the lower portions and the relaxing and opening, the allowing of more fluid to flow into the lower portions through that relaxing and opening. And then there are various other herbs that are positioned with that. Galangal's general, immune modulating, supporting with inflammation and circulation. But the other herbs are now very specific for certain areas. So the Sahachara is another key herb in there, and that's specific for the spine and the microchannels. So now by combining galangal together with Sahachara, in some ways we're focusing the energy more towards the lower spine, the lower circulation. And then there are other herbs in there that are powerful anti-inflammatories, immune modulators, blood cleansers, things that promote urination and the flowing out and down. So the more herbs that influence apana vata, the downward moving intelligence of urination, colon and gallbladder, the more that the formula may encourage more downward movement. And therefore the rest of the herbs that are in there are going to have more of that action where they're experienced moving downwards through those elimination organs. So that's part of why it moves more down, and they can classify formulas towards certain areas of the body because of the general nature of the herbs inside them. And then we could choose vehicles to then increase to move down or up, or timings of the day as well to increase where the formula will move towards down or up. Timings related towards meals will also influence where the formula will move down or up. But the most important is the original properties of the herb itself. What are its tendencies of movement?
So you've chosen to give it to him, or for him to take it after meals. Is that because after you eat, there's a downward moving force naturally?
In this case, it's because after we eat the food in the belly, and it's the least likely time to aggravate from a herb that may have some warming and stimulating and breaking apart properties. Although before the meal is the most downward moving time, that's the time that's associated with apana vata. Here I've not chosen after the meal because of a direction of movement. I've chosen it because of ease of digestion in relation to time of digestion. When we are digesting a food, we start off a dosha digestive process, an analogy of the doshas. We eat the food and straight away we're in the kapha related digestive process. It's called the kapha avastapak, the time of kapha post eating something. And depending on the person, that lasts from 30 minutes to an hour. Foods and herbs that are administered within the kapha avastapak are slower, kapha-like, to metabolize and move through the system compared to foods and herbs that are administered in the pitta avastapak. This is the time period an hour to 2 hours after a meal. It's also a diagnostic period. If there are kapha imbalances that are occurring 1 hour after the meal, it's likely because of kapha. It's in the kapha avastapak. Some gallbladder or ulcer conditions in the stomach or small intestine, we experience the pain 1 hour after the meal. This is the pitta avastapak, the time of pitta after the meal. And herbs can have a very quick penetrating effect into the body at this time. And then the vata avastapak is at least 2 to 3 hours or up to 5 hours after the meal. We're in the vata stage of digestion. We're more sensitive towards various herbs and substances during this time, and particularly formulas that may be a bit more sensitive or could aggravate the digestive tract, or in some way they may have more sharp or penetrating quick actions to them. They may be more useful to take after the meal, and therefore we sort of forget about timing of the day or timing of the meal in relation to movement. We just go ease of digestion as the priority, and we rely on the herbal formula itself to be the focus of direction of movement.
Thank you.
We see the same approach in many asarvams, the herbal wines, the arishtams. They're often taken just after the meals because the alcohol content has a tichnous, sharp, quick-acting property. So their ideal time of use is often just after the meal to allow the meal to counterbalance that sharp, quick-acting property of the medicine. There are still times that it may be prescribed on an empty stomach, but particularly if I'm going to give a larger dose like I have here, the 2 tablets, then after the meal is a safer time. Any other questions? Okay, wonderful to share with you. And I hope this has been a useful case study for you, and people will be able to see this case study on the internet in the future as well. So if you're interested to know more about how we practice medicine within ThaiVedic, you can be part of these mentorship groups by coming along to an event and first learning how to practice medicine with ThaiVedic. And then we can meet together and go through case studies and evolve on how we all practice medicine together. I learn from you as you hand in case studies, and you learn from me as I bring them into this big holistic lens of Ayurveda and functional medicine. I hope it's been useful for everyone watching now and in the future, and I look forward to sharing more great medicine stuff in our next chapters. Thanks, everyone.
Thank you, Kimmana.
Thank you.